Can you stop playing the blame game? You're having post-vasectomy pain syndrome and you're blaming the testicle because the pain is in the testicle. I am here with Timmy, the testicle from I Heart Guts, and Timmy wants you to stop playing the blame game because actually the culprit might not be in the testicle. It might actually be in your pelvic floor. Stay tuned. I want you to watch this video to the end to find out why and to find out what other connections you need to know about to really tackle this pelvic pain you're having and to truly overcome it. We'll also talk about some possible ways that you can begin a self-guided recovery plan to get rid of that pain and get on with life. This is a model of the male pelvis. What you see peeking through here is actually the spermatic cord going to the testicles. There's a layer of muscle tissue that comes from the abdominal area that goes all the way around the testicle, as well as fascia or connective tissue and nerve tissue. All of those literally have a physical connection with your abdominal area. Down below, right here, you have your deeper pelvic floor. Now the pelvic floor is pretty complicated. It's over 20 muscles in 3 separate layers. This is the deepest layer. What most people don't get examined and don't get assessed is layer number 1. I want to show you where that layer 1 is and why it might be the culprit. You have testicles, penis, but underneath you see these muscles here. That is your layer 1 or your more superficial layer or the front layer of the pelvic floor. They start here on the side of each sit bone. They actually go all the way around the anal opening, come back up, and they hug the sides of the pubic bone, but look where they end up. Right at the base of the scrotum and right at the base of the penis. That is very close proximity to the scrotum and pretty close proximity to where that vasectomy is. There is soft tissue from the scrotum that basically covers this area. And so there is a physical connection with these muscles as well. Often what we find when someone's having testicular pain is that these muscles tend to be very tight and very sore or painful to the touch. Whether that is fingertip pressure or, as you may know very well, whether that's sitting down on any kind of surface. When you're sitting down, you're literally sitting on this area of your pelvic floor. And if it's really angry and fired up, you are going to get pain when you're sitting. One thing I find very interesting is the question, which is yet unanswered, for someone who has post-vasectomy pain, have they had a past history of pelvic floor tightness? Or maybe they had some pelvic floor tightness, but it was kind of flying under the radar and it was low enough that it wasn't causing symptoms. You add a procedure right in the neighborhood, like a vasectomy, and that might be enough to put that over the top and start causing symptoms and pain. Now, as yet, that's a theory, but I want you to think about that. Are you one who might have pelvic floor tension or tension in your inner thighs, in your glutes, in your hips? And maybe you've had that for a while, but it really hasn't bothered you that much until you had the vasectomy. There might be a connection between those two things. Another area that is way underlooked in post-vasectomy pain isn't even in the pelvic floor. It's in your low back. Yes, in your low back. And here's why. There are nerves that come out of the spinal cord, go down here. This is your sciatic nerve here. You've probably heard about that. But coming off the sciatic nerve is this little branch. It's called the pudendal nerve. But what the pudendal nerve does is it branches off into 3 sections. And you'll see this on the model in yellow. The first branch is called the rectal branch, and that is right here. That goes to the area around the rectum. The second branch is called the perineal branch, and it goes to these muscles right here in the front of the pelvic floor. And finally, the last branch is the dorsal branch right here that goes to the tip of the penis. So it's important to maybe look at the low back as well and see if there's any soft tissue restrictions or movement restrictions that are not allowing those nerves to function the way they should be functioning. So now I hope you have a lot better understanding of the connection between the pelvic floor, the pelvis, the low back, the abdominals, and your post-vasectomy pain. Timmy the testicle often says, "It's not my fault, look elsewhere," and I would agree with that. The next thing I want to talk about is, what do you do about it? How can you start on a plan to help relieve that post-vasectomy pain? Honestly, if you can do it, by far the best way is to seek out a qualified pelvic floor physical therapist who treats men with pain issues. Now, I know that not everybody has access to pelvic floor therapy where they live, so that's one reason I'm doing these videos. While I cannot give a personalized program for you, I can give you some general guidelines and share some things that a lot of guys have found helpful in reducing or even eliminating their pain. One of those tips, believe it or not, is breathing. Yes, breathing. It's not hocus pocus. It's not woo-woo stuff. It works because of the pelvic connection to the diaphragm. Working on some guided breathing exercises can make a world of difference, and we have references in other of our videos on how to get started with that. The second tip is stretching. Stretching not only those pelvic floor muscles in front, but also stretching the muscles of the inner thighs, the glutes, the outer thighs. We've got some very easy and comprehensive stretches that you can start right away to help ease some of that tension, which could help relieve some of the pain and take the pressure off some of those nerves. The third tip is figuring out what ticks off the pain. And that's different for every guy, but there's usually a pattern. And once you find what that pattern is, then you can develop strategies on how you're going to tackle that problem and how you're going to develop new habits and strategies to overcome those pain patterns. It does take a little bit of work, and it's good to get some guidance on that, but it can be super effective. Fourth tip, especially if you are one who has pain when you sit, finding some good products that can help you relieve sitting pain. Now, that can be as easy as a couple of swim noodles. Believe it or not, we do have a video on that if you want to check that out, and how you can use a swim noodle to eliminate sitting pain. But other products are just as effective and can be really, really good, especially on a car ride or if you have to sit at work. One brand that I like to recommend is Purple Cushion. They have excellent quality sitting cushions, various thicknesses, that really help redistribute the pressure in that area so that it makes sitting a lot more comfortable. Other suggestions, like having a standing desk, can be super helpful if you have to sit at work. You can alternate between sitting and standing, and that can help as well. Thanks for watching. After learning about your pelvic floor and what it does, I hope that you too can stop playing the blame game and stop blaming Timmy for all of your pain problems. Now you know there are connections to other areas, and addressing those can make a world of difference. I hope that makes a difference for you as well.